Hello everyone, and welcome to our 15th week in our course on drugs and behavior. This will actually be our final week that has new content. Next week will of course be the week of the final exam, so there will be a lecture just for the purposes of review, going over material from the second half of the course, and sort of wrapping up content and looking at trends in what we've studied so far in the course, and trying to bring it all together. But there will be no new content next week, just the final exam, which everyone should have gotten an announcement about earlier this week. Okay, so this lecture will be about performance-enhancing drugs, and then next lecture will be about two topics, drug prevention and drug treatment. Obviously, these are related topics, but we'll cover both of those next time in lecture 30. Okay, so we're going to look at performance-enhancing drugs, and this will be largely from the perspective of athletics. We've talked a little bit about cognitive enhancers in our section on stimulants. And of course, there really are no cognitive enhancers for sophisticated cognition. You can enhance reaction time for simple tasks, but there's no drug that will make you appreciably smarter than you were before. So we're going to be talking about largely about physical performance, not mental performance here. So performance-enhancing drugs have a long history. They have a relatively short history in terms of what's actually effective. But performance-enhancing drugs are, of course, a large part of many folk medicine traditions. So they have a history. We'll talk about some of that more recent history than ancient. We'll also talk about what the effects are for performance-enhancing drugs. So when we think of performance-enhancing drugs, especially with regard to athletics, we usually think of steroids, and we'll talk about that in this lecture, but there are other drugs as well. They have different effects and different side effects. We'll talk about the legal status at the end of the lecture, so some of these substances are more regulated than others. Again, one of our criteria for drug scheduling is whether the substance has a legitimate medical use. And especially steroids have a number of legitimate medical uses, despite the fact that they can be used in an inappropriate manner. So what we're going to do is we're going to look at three basic groups. One is the stimulants, which we've already spent a whole week on, so we're not going to go into the details on how stimulants work because we've already covered that. We'll go over steroids, which we haven't talked about yet. And then there's some other compounds, sort of a miscellaneous group. And all these things are used as performance-enhancing drugs. Most of these that we'll talk about are psychoactive in some way. A couple are not, but they fall in the class of performance-enhancing drugs, so we'll go over them briefly. Okay, first let's talk about last week's discussion questions. And last week, obviously, we were talking about opioids. And one question was about overdoses. And the fact that combining drugs, especially in a recreational setting, is typically far more dangerous than the risk of single drug overdoses. Now, obviously, when we're coming to the topic of opioids, single drug overdoses are possible, perhaps even likely, depending on the experience, expertise, status of the user. So the question here is, how do we approach the fact that combining drugs is often more dangerous than using a single drug at a time? And a lot of people put emphasis here on education. So if we tell people how dangerous it is to combine drugs, then they'll be aware of the problem and they'll avoid it in the future. And as we'll see in this upcoming set of lectures, education only gets you so far. That many times it is not necessarily a lack of information. Sometimes it is. But it is not always just a lack of information that leads people to make bad decisions when it comes to drug use. So education can get us part of the way there, telling individuals how dangerous it can be to combine drugs, especially certain classes of drugs. And one thing that's interesting is that despite how dangerous combining drugs can be, there really aren't any anti-drug campaigns that focus on combining drugs. So there are anti-drug campaigns that are generic, like the My Anti-Drug campaigns. And there are certainly campaigns against particular drugs, like methamphetamine, for example. But there really aren't any campaigns that really focus on the dangers of combining drugs. So how would we do that? How would we approach such an anti-drug campaign? Is it worth investing in? Given it's a more complex topic, it's not as simple a message as stay away from this drug or say no to drugs in general. Really focusing on combining drugs, some people worry that it makes it seem as though single drugs are no longer dangerous. And of course they can be. Again, the point is that combinations can be more dangerous. And when it comes to at least prescription drug use, there's a role to play for doctors and pharmacists. So these are trained professionals that know about drugs and drug interactions and dosages. So they will usually advise the patient against combining a prescription drug with other drugs, especially alcohol. If there are multiple prescription drugs going on, then the doctor or pharmacist should be aware of that and should not prescribe uh, drugs that are going to be dangerous in combination in the first place. But if it's recreational drug use, the doctor can advise against certain recreational drugs when giving a prescription. Now, of course, if all the drugs are recreational or are not being obtained from a legitimate source, then doctors and pharmacists can't really intervene to that same degree. So it is a tough question, and how do we emphasize that? How do we get the public to acknowledge and realize that combining drugs is often more dangerous than single drugs by themselves? The other question was about the drug naloxone, and the question of how available naloxone should be to the public. So naloxone, if administered to someone suffering an opioid overdose, can reverse the effects of that opioid very quickly and can prevent death. It can save lives. And so the question here is, should it be publicly available, or does making that substance available send out the message that opioid use is condoned or is not dangerous? And there were opinions on both sides of this issue. So whether or not people should have wide access to naloxone. And again, the counter argument is just what I said, that some people feel that it could encourage opioid use if that if that life-saving mechanism is out there. And of course, there's been research on similar topics, things like seatbelt laws or helmet laws, whether having this kind of safety net encourages unsafe behavior. And it depends on which area we're talking about. To a certain degree, it does, but at least in the case of seatbelts, for example, it still seems to be worth it. It still seems to be worth saving lives. It saves more lives than it puts at risk. Now, for naloxone, that is an open question because we don't have those data. The only way to know is to try it and observe. And of course, another question here is, if it's not publicly available to everyone, should it only be available in certain settings and to people of certain professions? And if so, which ones? So it's certainly available in hospital settings. Questions of whether it should be part of every first responder's toolkit, so to speak. There are certain counties, certain states that are experimenting with having police forces carrying around naloxone for just this reason. So traditionally, you can find it in hospitals and administered by medical professionals. But of course, especially if someone is overdosing, first of all, they may not have access to a hospital, especially if they're the ones overdosing. But even those around them may not be able to get to those settings fast enough. Even if they can, they may not do so for fear of getting caught, of running into the legal consequences of opioid use. And so that's another question, is if we limit the people and the settings for which naloxone is available, do we turn people away? Do people become afraid of trying to get access to naloxone and risk letting someone die if they're overdosing? And of course, if it is available to the public, it's important for the public to be knowledgeable on this subject. So both in terms of administration, and that they've made this fairly easy in terms of how you administer naloxone, but especially in recognizing the signs of an opioid overdose. It's only effective if you use it and if you use it in time. And so, once again, education is an important component of trying to fight opioid overdoses. Okay, so first things first, talking about performance-enhancing drugs, the first thing is, what do? And they can have a variety of effects. I mean, the glib answer is that they enhance performance. But more specifically, commonly they increase muscle mass. Of course, when we talk about this class of drugs, we're thinking about steroids and other legal substances like creatine. We'll talk more about that later. Performance-enhancing drugs can also increase overall size, muscle size, but also the size of other tissues. And if someone is still growing, they can increase height. And here we're talking about human growth hormone, which can be available by prescription to individuals that have deficiency, but can also be used by athletes to increase muscle mass. Although, as we'll see, the effectiveness of that is in some question. Also increasing speed and endurance. So here we're talking about stimulants in particular, which, as we'll see, are a very popular group of performance-enhancing drugs that most people are not aware of. They're aware of stimulants in general, of course, but they're not aware that they're very commonly used in professional athletics. And then there's erythropoietin, also known as EPO. This comes up, particularly in cycling scandals. This is a substance that promotes the generation of red blood cells. It's not psychoactive, so we won't talk about it that much, but it does increase endurance via a totally different mechanism. But it is something that is regulated by organizations that govern sporting events. Of course, there's analgesia. People that are heavily active physically also are more prone to injury and long-term stress in their body, and so they tend to have at least acute, recurrent pain, if not chronic pain. And now we talk about analgesia as a potential performance enhancer. If you can take a drug that knocks out your pain, then you're not going to be distracted by it. It's not going to impede your performance. So here we're talking about not so much the opioids, because those tend to sort of counteract athletic performance, but other analgesics that are in common use. Of course, one thing performance-enhancing drugs do, in addition to the qualities the user is looking for, they also produce side effects. And of course, these side effects depend on which drug is being used. So a big question, especially when we're talking about improving athletic performance, is why do we care? So we've talked about drug use in general and drug abuse that can lead to negative consequences up to and including death, and that are times that have been fairly pervasive in society. Now we're talking about people who are doing better in a sporting event. So how much do we care? There are a variety of arguments for why we should care. One is that having athletes that take performance-enhancing drugs and aren't punished for it in any way has an impact on children, that athletes are often role models for children, and so if they witness this behavior, what is that going to do to their own behavior? How are they going to learn from that lesson that somebody takes these drugs in order to perform better in the sporting event? How strong you think that argument is up for debate. Should a 20-year-old in a particular athletic event be a role model for children? It's up to you. But that is one of the arguments that's put forth. The other big one, of course, is that it violates our concept of fairness, that using performance-enhancing drugs is somehow unfair. This will actually be a topic of one of the discussion questions, is there are a variety of ways in which one athlete might have an advantage over another. Performance-enhancing drugs are just one of those ways. So to what degree should we focus on that particular aspect? Finally, and what I think is the most important one, is that it does have an impact on health. And so performance-enhancing drugs affect the health of not only the individual that uses them, but also on those around them. I mean, obviously, especially in a sport with heavy contact like football, if you have somebody who's taken a lot of performance-enhancing drugs, they can do more harm to the people around them And also there are psychological effects for some of these substances. And that way they can impart sort of a social harm to those around them, even not on the playing field. So those are all reasons why we could and probably should care. So actually, before we get to steroids, which again are what we usually think of when we bring up the topic of performance-enhancing drugs, we'll talk about stimulants, which is a topic we've already covered. So in this arena, they're often referred to as ergogenics, that is, energy-producing compounds. And these have been around for a long time. Some were sort of fanciful, they were folk medicine, didn't really work. But there is some evidence that the ancient Greeks and the Aztecs and other groups did have natural substances that may have had stimulant-like effects. More recently, you have substances like strychnine, which today is a substance we all associate with poison. So it's used as rat poison, but obviously it's poisonous to humans as well. But in smaller doses, it acts as a stimulant to the central nervous system. You take too much of it, you get convulsions and eventually death. But in small doses, it acts as a stimulant. But of course, strychnine was involved in quite a few deaths in the 1800s up through the early 1900s. Its use kind of tapered off in the 1960s because of the rise of amphetamines. For cocaine, cocaine was, of course, around longer than before amphetamines. It was around for the last couple hundred years. But cocaine has never been as popular a performance-enhancing drug, mainly because its effects just don't last that long, especially for endurance contexts. And endurance is one of the things that stimulants seem to enhance for appreciable periods of time. So amphetamines, soon, once they were developed, soon became a very popular performance-enhancing drug. Of course, they were used in World War II on both sides of the war. We've already talked about this in our unit on stimulants. But they'd been synthesized just a couple decades before World War II. And once the war was over, more and more people knew about amphetamines. And they've caused actually a number of deaths through overdose in competitive events, mainly because they raised body temperature. And so athletes, of course, are exerting themselves, have a higher body temperature anyway because they're generating a lot of body heat. And especially in outdoor events, they can also prevent you from sweating as much as you should. So that combination of being in a hot environment, generating more body heat than you usually would, and not sweating as much as you usually would, have led to death. And of course, after World War II, they became more popular, and regulatory authorities began to notice that amphetamines were becoming more popular. And so there was an increase in testing. And of course, eventually, there were the drug abuse control amendments of the mid-60s, which we talked about in our unit on drug policy and regulation. And so you have a crackdown, so to speak, on amphetamine use, both outside of athletic competition, but also with regard to athletics. So, of course, a big question is, do they work? They have their dangerous side effects, but what's the incentive to take them? So they do, as we've already seen in our unit on stimulants, have a few consistent effects. They improve alertness, so wakefulness when somebody's engaged in a long competition, a long race, or have to play 2 games in one day. Amphetamines increase wakefulness. They fight fatigue. Improvements in reaction time, so your reflexes are faster. They also seem to improve endurance. So again, this idea of combating fatigue. And the fact is that the studies show that these improvements are really pretty small, but the fact is that a 1% improvement can be a big deal in an athletic competition. So here you have a picture of Usain Bolt, the Jamaican sprinter, and he's next to his new world record. And I'm, just to preface, not saying that Usain Bolt was using any sort of performance enhancer. I'm just pointing out that Bolt's new world record beat the previous world record by around 1/10 of a second. So that 1% can make the difference between second place and a new world record. So that 1% improvement sounds small, but if you are a professional athlete, that could make a big difference. Of course, stimulants have their side effects. There are cardiovascular effects, although those seem to be not as prevalent in younger individuals. The bigger danger, as I mentioned, is this increased body temperature. And there are athletes that seem to have died from that. Of course, there are the psychological effects, things like anxiety, paranoia, and insomnia. So these are all negative side effects. These are unwanted. Um, but again, if you're looking to be alert, if you're looking to stay awake and alert through that double header, then afterwards you may actually suffer insomnia. That is the negative side effect. It promotes wakefulness not just when you want it, but at all times. Okay, moving on to the second group of performance-enhancing drugs, and the most famous, that's the steroids. So steroid itself doesn't necessarily mean a performance enhancer or what we think of in terms of its use in athletics. A steroid is a chemical designation. So there are a lot of different steroid compounds, and you may have been prescribed some yourself. So over here on the right is a diagram showing what basically the criterion is to be classified as a steroid. It's these 4 hydrocarbon rings in this particular configuration. Any chemical compound that looks like this, that has these 4 rings in it, is a steroid. So it includes things like cholesterol, which we know from its effects on cardiovascular health, but cholesterol is an important part of your cell membranes. You can't live without it. But it's a steroid, as is cortisol, which is a hormone that's released in response to stress, and it's sold as hydrocortisone. So this is a steroid. Obviously, it's not one that's going to increase your muscle mass, but it is nevertheless a steroid. There's also estradiol, which is, when people say estrogen, this is usually what they mean. Technically, estrogen is a group of related compounds, of which estradiol is the most important. But that is a steroid, as is its male counterpart, testosterone, which is an androgen, and there are multiple androgens. But testosterone does things during puberty, like increase muscle mass, increase size, and of course it produces secondary sexual effects like facial hair, the deepening of the voice. And so at first testosterone was used as a performance enhancer, but fairly quickly it was discovered that what athletes really wanted was a substance that had the muscle building and the recuperative effects of steroids, of testosterone, without the masculinizing effects. So they wanted enhanced muscle development and enhanced recovery time without the masculinizing or androgenic effects. So facial hair, deepening of the voice, the sort of secondary sexual characteristics that we associate with male development. And there was later than you would think, there was sort of a scandal in Major League Baseball. So Major League Baseball had been testing for steroids, and it was rumored that steroid use was actually fairly common in the U.S. in Major League Baseball. And there was what's called the Balco scandal in 2003, which was this company, this Bay Area laboratory company, had developed a steroid that was anabolic, which anabolic in this case means it promotes tissue growth. So it promotes muscle development in particular. And what the scandal was this company had developed a steroid that wasn't detected by Major League Baseball's tests. And so a lot more players were using steroids than Major League Baseball was aware of. But because they weren't testing for this compound, it was getting through. Later, of course, they amended their tests, so now that substance is screened for. So what do steroids do? Well, there are the obvious physical effects, and here we're talking about anabolic steroids, so steroids that build up the body. That's what anabolic means. One of the most important effects is it decreases recovery time. So anytime your body is damaged, whether it's through working out or through some sort of injury, steroids can cut down that recovery time. This is used both in hospital settings and in athletics. so you can work out twice as often. And of course, famously, anabolic steroids increase muscle mass and increase strength. At first, it was ambiguous whether they really increase strength. We'll come back to this idea later. But now the evidence is pretty conclusive. The question, though, is, sure, anabolic steroids improve muscle mass, increase muscle mass, but that's typically, these steroids legitimately are typically applied to individuals with low levels of testosterone or whatever steroid of interest you have. So the question is, sure, they can enhance when someone is deficient in a steroid hormone. What if their hormone levels are normal? What would testosterone or testosterone imitators do in that case? And there the evidence is a little hazier. It's not clear exactly how big an effect steroids have when your testosterone levels are normal. Generally, for anyone, testosterone or compounds that imitate it, the anabolic steroids, have androgenic effects. So they promote facial hair growth, they deepen the voice, but they also increase muscle mass. But in the long term, there is some connection between taking too many steroids, and here athletes take massive amounts of steroids. So again, that's one of the reasons the evidence isn't entirely clear, because you can't conduct a study taking that much hormone. It's not ethical. But athletes nevertheless take massive amounts of these hormones and usually do what's called stacking, which is taking multiple hormones at once. And there's some evidence that this later increases the risk of heart disease. And for males, prolonged and large magnitudes of steroids can actually eventually cause atrophy of the testes, the sexual organs, and what's called gynecomastia, which is the development of breast tissue. So this first one seems a little counterintuitive. If you're increasing these masculinizing effects, why would it atrophy the testes? Well, the answer is that if you're basically taking a bunch of testosterone or something like it, the testes, in a way, no longer have a job to do. So they atrophy because there's enough testosterone in the body already. They don't need to produce any more. So these are just some of the negative side effects of steroids for the male population. For women, of course, the effects are those androgenic effects, deepening of the voice, growth of facial hair, acne, these sorts of things. Psychologically, there's some evidence that steroids have psychological effect. Certainly, most users report that they can tell when they're on steroids, that they have elevated mood, that they feel like they have more energy, and this leads us to what's called the active placebo effect. And what that is it's not necessarily that steroids, anabolic steroids, increase muscle mass, but they change the person's perception of their body. They change sensation. They change the individual psychologically. And it's actually that psychological change that causes them to work out more, for example. So the psychological change induced by steroids causes the person to change their behavior, and that's what changes their physiology. So that's what the active placebo effect is. It's not a direct link between steroids and physiology, but one that's mediated through psychology and through behavior. There's also what we've all heard of as roid rage, which is the idea that individuals taking steroids are more prone to losing their temper, more prone to violent confrontation. There's some evidence of that, but of course, there's also, once that idea is embedded in the public mind, that can be taken advantage of. So you can blame steroids for violent outbursts, when in fact it may not have been the steroids at all. And of course, in athletics, you're already, especially for certain sports, you're already selecting for a population exhibiting aggressive behavior. So it's not that surprising that individuals continue that aggressive behavior outside of the sports event. Anyway, so roid rage, there's some evidence for it. And again, we see other effects as well that are psychological, like depression. So when the user is on steroids, their mood tends to become elevated. When they go off, they tend to become depressed. And so that's just another psychological effect of steroids that seems to be valid. Okay, but it's not just stimulants and steroids that are performance-enhancing drugs. You also have human growth hormone, which has come to be popular in recent years. Of course, early on it wasn't available. But this is something naturally produced by your pituitary gland. It's what causes the body to grow so much during puberty. But of course, taking even more of it does increase overall growth, not just of muscle tissue, but of the entire body. So if you're an individual that's still growing, and you take human growth hormone, you will grow taller than you otherwise would, given that you're taking regular doses of human growth hormone. And in fact, for individuals that are deficient in human growth hormone, this can help them reach an average height. There's some question as to the psychological effects of human growth hormone. In individuals that are low, that are deficient in HGH, there's some evidence for an increased likelihood of depression. So human growth hormone may prevent depression, but only, again, in the sense that without it, you would be deficient. So it's not the idea that taking human growth hormone will make you happier if you have normal levels, but if you have low levels, it does seem to fight off depression. And of course, HGH is also involved in brain development. So it is, in a sense, a cognitive enhancer insofar as it fosters cognitive development for the developing brain. But again, we have a question of how effective it is in athletes. So for certain steroids and for human growth hormone, you have this increase in muscle mass, but there's limited evidence that you actually have an increase in strength. So what may be happening is that the muscles themselves grow, but it's because they hold more water. That these hormones, and steroids may increase the amount of water that is retained by the muscles, so it increases your lean body mass, increases your muscle mass, but you're not increasing strength. All you're doing is adding more water to the muscles themselves. And of course, there are performance-enhancing drugs that are non-psychoactive. So I'll mention those briefly here. There are the beta-2 agonists, which are sympathomimetics. That means they activate the sympathetic nervous system, particularly the lungs. But they don't have, they're more specific, so they don't have all the sympathetic effects that, for example, amphetamines do. By the way, the beta-2 agonist is acting at an adrenergic receptor, which is the receptor that responds to adrenaline, otherwise known as epinephrine. You also have creatine, which is thought to basically supplement the body's energy supply. And again, this is one of these compounds that seems to increase muscle mass, but perhaps not strength. So maybe creatine is just pulling more water into the muscles. It should be noted that creatine also, if it is helpful, helps in short sprints. So it doesn't really help with endurance. It helps with short-term strength if it helps with anything at all. And then there's erythropoietin, which is, again, the chemical that signals your body to produce more red blood cells. Red blood cells are, of course, the part of your circulatory system that carry oxygen and nutrients. So the more of those you have, the quicker you can replenish your body, replenish muscles that are active with the energy and the air they need. It, of course, is heavily regulated by sporting bodies, especially in cycling. There are EPO scandals every now and again. But the erythropoietin itself is not psychoactive, so we're not going to spend a lot of time on it. Okay, now moving into regulation of performance-enhancing drugs. One distinction to make, of course, is the difference between government regulation of a substance and the organizational regulation. So a substance may be legal for the public domain, but would disqualify a participant if they tested positive for it in an athletic competition. So here on the right is a table from your book, and these are the penalties for using performance-enhancing drugs in Major League Baseball. And so there are steroids and there are amphetamines listed. So as it turns out, the penalty for steroids is far more severe than that for amphetamines. And that's an issue of some controversy. Amphetamines are actually more common. Amphetamines are far more common than steroids in terms of their use in athletic endeavors. So that's been brought into question whether the penalty should be less severe for amphetamines than for steroids. So that is one of the controversies in testing. Another, of course, is do we really need to be testing for everything and every athlete? It's inconvenient for the athlete, it's inconvenient for the organization, it's expensive. And this gets back to the why do we care question. So there is some validity to that. Do we really need to screen for everything? Especially when there are different laws in different places. So here in Colorado, obviously, and in Washington, marijuana is legal. But many sporting organizations don't allow it. You can be fined or suspended for having it found if you test positive for it. But of course, if it's legal in the state, that creates sort of a tricky issue. We're not breaking the law, but again, of course, it's up to the sporting organization. And again, marijuana isn't really a performance enhancer. Do we really need to be testing for all these compounds, especially those that don't actually change athletic performance? And the other issue here is highlighted by the Balco scandal, where there's this sort of arms race between the tests that the organizations run, the tests that are available to run, and new drugs that are developed. So if you can develop a performance-enhancing drug that isn't detectable by any of the tests currently being used, then there's a big market for that. And of course, it takes a lot of resources and time to develop new tests for every new substance that comes on the market. Now, in terms of government regulation of these substances, of course, amphetamines we've already talked about. They're on Schedule 2. Schedule 2 being, of course, the second most restricted. There are legitimate uses for amphetamines, and as there's a section of your book that points that out, that there are a disproportionate number of athletes who have been diagnosed with attention disorders. And what's the prescription? Well, it's things like Adderall and Ritalin, which are forms of amphetamine. So amphetamines are on Schedule 2 because they do have legitimate medical use. And while steroids have a number of legitimate medical uses, they're on Schedule 3. Human growth hormone isn't actually scheduled, but it is a felony to use it if it's not for a legitimate prescribed purpose. So if you're deficient in HGH, you can get a prescription for it, and that obviously is not illegal. But using HGH if you don't have a legitimate reason is. So that's a felony. Okay, that will do it for performance-enhancing drugs. Next time, we'll talk about drug prevention and drug treatment. In particular, we'll look at how our society has understood drug use and how to prevent it, how to treat it. How do we address it? There are a variety of methods, depends on your point of view of drug use. And then how effective are these methods? So we'll talk about that next time, and I will see you then.